the stomach 38. Please, now coming points are in fact very crucial points, and please focus what I am telling you. Every point is the key point to treat for the numerous diseases. But however, already I told you about 37 and 38. The point is called as a Yaku. So that point is located 5 tune distal to the stomach 36 and 1 finger breadth lateral to the border of the tibia. So this point is good point to treat for the numerous diseases, but in fact this point to be called as the anesthetic point. This point to be called as a distal point for the shoulder. This point to be treatable for the, especially for the right shoulder and the left shoulder conditions, and also for the cervical issues. But this point is located exactly on the anterior tibialis muscles. So this another name called as a Wei Ma. Wei is the external, Ma means in Chinese is anesthesia. There is another point called as a Sung Tu, the Z-H-O-N-G-D-U, Chung Tu. So that also point to be located 7 tune proximal to the medial malleolus on the border of the tibia. So this point is called as a Ni Ma. Ni means is internal, Ma means is the anesthesia. So therefore this both the points, liver 7 and then stomach 38. These points are, in fact the points are located in the ideal location is 7 tune proximal to the lateral malleolus, 7 tune proximal to the medial malleolus. So this point is located on the dorsal region, the another point is located on the ventral medial side of the leg. So therefore this point, even in China, by activating the strong electrical stimulation, these 2 points are good point to treat for the tooth extraction and also for the back surgery, or in most of the surgeries they use these 2 points for the anesthetic purpose. So therefore, once you are applying as the manual stimulation doesn't work, but here it is recommended to activate the strong electrical stimulation to these 2 points, really good point to get the anesthetic effect. So therefore this point is good point. Even the right shoulder pain is there, you can activate the stomach 38. Better where and how and which part we need to apply. This is very important you remember. The stomach 38, the point is treatable for the shoulder where the acromion process of the shoulder is there. The anterior margin of the acromion process, there is the pain. So that indicates that this particular area is the pain. That indicates the stomach 38 is good. There is the posterior acromion process. There is the 2 dimples on the acromion. The anterior dimple pain is there on the shoulder. Then stomach 38 is recommended. Then the posterior dimple of the shoulder pain is there. Then Yang Ling Chuan. That GB34 is recommended. When the pain is on the small intestine meridian, which we call as a Chianzen, that is SI9 area, the shoulder pain is there. Even for that pain, we indicate the distal point is P Yang, that UB58. So in this way, we have to activate to try to find out which part of the shoulder pain are you suffering. Based on that credentials, we need to apply the needling. But how to understand this analogy? So try to understand what principle I used here is, when there is the Yang Ming is affected on the shoulder, the leg Yang Ming point is to be activated. When the Shao Yang is affected, the leg Shao Yang to be activated. When Tai Yang is affected, UB, that is small intestine meridian, UB is the Tai Yang point to be activated. When the Ju Yin meridian, the pericardium meridian is affected, then you use the liver 8 is the Ju Yin point. When there is a Shao Yin meridian is affected on the heart meridian, then select the Shao Yin of the kidney meridian, that K10 point I told you. Right? When the Tai Yin is affected, LU2 Yunmen, then select the point is Tai Yin meridian of the foot, that point to be called as a Yin Ling Chuan. So that is spleen 9. So So therefore in this analogy is understand, so based on that, but all these points when I told you on the medial side, better you just apply the contralateral side of the knee is selected. When you are treating in the young side, better you can select on the same side or the contralateral side also recommended, because it works together. Either you use on the same leg. So on the left shoulder is pain is there, left leg you can activate. When the right shoulder pain is there, even right leg you can activate or the left leg you can activate. If you are activating bilaterally also really good, or the unilateral also it is really crucial. You understand when the person is suffering for the shoulder pain, right shoulder pain, always you remember it is related to the gallbladder meridian issues. When the person is suffering for the left shoulder, that related to the lungs disorder, also that's related to the spleen rupture or spleen malfunction also causes. Always you remember when the person is getting the pain on the left shoulder, you ask them there is the pain on the below the ribs, intercostal ribs. The patient says, yes, I do have the pain in this region. If there is a pain in this region, you remember it is related to the spleen. When the pain is in this region also is there, then related to the lungs related disorder causing the pain on the left shoulder. When the person is getting pain on the right shoulder, there is a motor point called as a Chianchi. That point is gallbladder 21. So that point also to be called as an endocrine point. You just keep giving the pressure. If the patient says, ouch, I have the pain, so that indicates it is related to the gallbladder. Better you can activate GB34. Better you activate, there is the point called as a RIU. RIU is the gallbladder alarm point located on the rib region. So in this way you can activate by using stomach 38. But majorly says the Chinese people, whenever you wanted to treat the shoulder pain, you just deplete the energy of the stomach 38. That means you just bring the energy, decrease of the stomach 38, reduce the stomach 38 energy to get the relief of the shoulder pain. Even there is the capsulitis or the bursitis or the frozen shoulder conditions where there is the freezes inside the capsule, where the glenoid cavity issues. Even that conditions also you just reduce the energy of the stomach 38. But Chinese says you do it first and then later on you start the other treatments. Later on you just use the local point. That local point you call as a Yunmen and Qianyu, Qianzhen. So these are the points are really good. LI 15, Sanjio 14 and SI 9 and then LU 2. These points are really good to activate for the shoulder pain conditions, but at the same time the another point called as the small intestine 15, that point also good to treat Tuchun lateral to the DU 14, that also good point to treat for the bone related conditions and also to treat for the shoulder muscles as well. Because of the scapularis muscles, the shoulder scalene muscles, where there is the nerves which is communicating innervations of the nerves which starts from the C4 to C5. There is the obstruction in the neck region where the dermatome and where the we call as a dermatome, sclerotome and enterotome. So these are not functioning properly. So that causing the problem on the radial nerve, or that causing the problem with the pharynx nerve, that causing the problem with the musculocutaneous nerve, which causing the pain on the shoulder region. So due to that reason you activate the nerve innervations origin from the neck region and then communicate and activate that points to regulate the blood flow to the shoulder girdle muscles and deltoid muscles. There is another muscles, motor point for the deltoid muscles, the anterior deltoid muscles and the middle deltoid muscles and posterior deltoid muscles. All are muscles to be activated. But however, generally the one point, the bina, which we call as a motor point for the anterior deltoid muscles, that point to be activated, that point is LI 14. So that point is good to strengthen the deltoid muscles in the naturally, and also you can activate the local point and distal point in order to get the relief for the shoulder pain in generally. But I told you one point, Shauza is the good point to drain out. When there is only the small intestine energy got stagnated, the meridian energy. So that time to remove that obstruction to get the shoulder girdle pain relief. But at the same time shoulder muscles is not the reason, only one reason to cause the shoulder pain. Shoulder pain reasons are numerous, but I told you where are the reasons to causes. certainly you can incorporate it, all the points, or you select diagnose which meridian, which particular pathway is affected based on the principles. Name sharing meridian, you just activate thigh in is affected, lungs meridian, activate the another thigh in or the spleen meridian. This will be certainly you can feel drastically changes in the short period to get rid of the shoulder issues, right?